A 2CC Marcus Paul podcast.
I'm very happy to say that Dr. Stephen Parnis, who's Vice President of the Australian Medical Association and an emergency physician, joins us on Canberra Live. Good afternoon, Doctor.
Hi, Marcus.
I'm well, thank you, and I guess this is a victory for quite a lot of people. And why is it that the AMA were unhappy about the planned changes?
Yeah, well, it is indeed a victory for common sense. I think we were very concerned about this because the implications for the provision of healthcare in general practice would have been quite devastating. So the fact that the government stopped them from occurring, didn't put themselves in front of the Senate, who were likely to disallow this in February or March, means that hopefully we won't go backwards in really the most important and efficient aspect of our health system, which is the GP in the community.
Now, Doctor, what would have these changes meant?
It would have meant that for about a quarter of the consultations that GPs have, where they see a patient for less than 10 minutes, that the Medicare rebate towards the patient would have been gone from $37.05 to $16.95, a greater than $20 drop. And GPs, if they absorbed that, would have faced, I think, unviable businesses and potentially had to close their doors, or patients would have had to pay out of pocket, and for many, something like $20 is a huge impost.
How much of an impact do you think that the AMA's rallying has had to force this back down?
Well, I know that most doctors are not particularly interested in engaging in the political process. They want to focus on caring for their patients and getting on with their work. But the amount of feedback, everything from despair to rage that we have received from our GP members has been incredible. The most profound I have seen in more than 10 years in an AMA leadership role. So we had no doubt that we really had to go very hard to point out the error of its ways to the government, and we're glad that they've listened on this.
I guess the important question too, Doctor, is whether our healthcare system is financially sustainable. I mean, the government, rightly so, in some quarters, is looking at ways to better manage costs.
We have no problem with the notion of economic responsibility. What we think is that the painting of health as being a place where health expenditure is exploding is something that we disagree with. I mean, if you look at the federal government outlays, health as GDP is 9.7%. So as a nation, we spend less on health than most of the other advanced economies in the world. And yet we get better outcomes. People live longer in this country than most others in the world. Yeah. If you look at the federal government, their amount of spending has gone, and we're not talking absolute dollars, let's talk percentages. That's what really matters. As a percentage of federal budget, we've gone from 18% a few years ago to 16% of federal government outlays. So health is doing more than its fair share. And the other issue is, of course, we need to think about health, because if you don't have good health, then every other aspect of the economy is almost futile. You've got to be well to work. You've got to be well to be economically productive. And what we need to see from the federal government is what their priorities are as far as health goes, not their priorities as far as cutting health dollars.
Yeah, there is nothing probably more important than your health, Doctor, and I'd certainly agree with that. Do you think the government will try to rework this policy, or is it in fact, if you excuse the pun, dead and buried?
Well, I think this particular measure of trying to rework A and B should be gone. It belongs in the history books. But we take to heart what Minister Lee said today, which is that she is determined to consult with the profession. That is what we have been calling for all along, because the unfortunate reality has been that we've had government announcements and then we've had to call them to account for the problems that they've had in their policies. And we have always said, not just to this government, but to governments before and to the ones that will follow, that the AMA is there to be an impartial source of advice, to advocate on both our patients' behalf, the health system's behalf, and the perspectives of the doctors. So we're being consistent here, and we will be a constructive influence, and we welcome the fact that she's opened the door to us.
Okay, I'm about to speak to Terry Barnes, who's a policy consultant and former advisor in the Howard government. Now, on Twitter, Mr Barnes has described the AMA as the CFMEU in white coats. Is that something that you find offensive?
Oh, look, I'll let other people comment on that. We try and not make it hysterical. I think what we want to do is focus on the merits of the case, and I suspect Mr Barnes should do the same.
All right, good to talk to you, Dr Stephen Parnis.
You too, all the best, Marcus.
Okay, thank you again, Doctor. Dr Stephen Parnis, the Vice President of the AMA, and he's also an emergency physician. Well, let's go to Terry Barnes now. Of course, Terry's joined us previously on the program here at Canberra Live, a policy consultant and former advisor in the Howard government. G'day, Terry.
Hello, Marcus. How are you?
I'm well, thank you. Now, just you would have heard the interview there with the doctor. What do you mean by describing the AMA on Twitter as the CFMEU in white coats?
Well, essentially, the AMA is the doctors' trade union. It is an industrial association more than it is a professional association. This has largely been an issue over the last, or since the budget, about doctors' incomes. They fear that their income stream from Medicare and from public subsidy is going to be cut. And I think the Minister today has made the best best fist of a bad hand. Yeah. But essentially, I think the message out of what happened with this, which was basically sound policy in relation to levels A and B of the GP schedule. It became a beat-up, a distortion, the end of civilization as we know it, and it simply wasn't. I mean, basically the AMA, Marcus, I think, is channeling John Howard. They're saying, we decide who comes to Medicare and the circumstances in which they come.
Okay. Now, do you think the changes to the Medicare rebates, what do you think the changes have meant, in essence?
Well, the changes haven't happened, but basically, and now they won't happen, but essentially what was going to be done here was to basically put a time limit floor under the standard GP consultation item, the level B item for Medicare, so that you'd have at least 10 minutes with the doctor. And most people do, and most people on Monday, if it had stayed, would have continued to do so. But the quick and easy things that doctors do, you know, the immunisations, the wound checks, the writing of repeat scripts and so forth, they don't need a full consultation. And that level A, that short consultation has always been there. Now, what has happened is because the current level B is up to 20 minutes, that could be from 0 to 20. So level Bs are being charged for what should have been done on a level A. I mean, effectively, the government was trying to close a loophole. Now, if it was tax avoidance, the government would be patted on the back, but because it's Medicare, they're being kicked up the bum.
Yeah, it sounds that way. And, of course, I meant to say the changes would have meant, but you've answered that, and I appreciate it. Now, I guess the important question is, and I asked Dr. Stephen Parnis this as well, is about the sustainability of our health system. Is it unsustainable the way that it currently is?
Well, at the moment it is sustainable. I don't disagree with him on that. I heard his comments at the tail end of his interview. But the problem is that we have to think about the future. We have to think into the middle of the century, particularly when the baby boomers of today become the rather old and high service using people of 10, 20 years' time.
I mean, that's right. We do have, sorry Terry, we do have in this country an ageing population, and that always needs to be taken into account when we're talking about health policy.
That's correct. And if you actually think about it, there's a demographic time bomb with younger people as well, particularly those who aren't as fit as they should be, who don't exercise as much, who eat badly, become obese. I mean, we could be dealing with a double tsunami of demand in mid-century that we actually have to prepare for now.
All right, Terry.
Sorry, Marcus. I mean, the way, again, to sort of channel John Howard, I mean, he used to say about good policy that you fix the roof when the sun shines, and that's what the government has been trying to do all along. What they haven't done is communicated effectively.
Sure. All right, Terry, always good to talk to you. Look forward to our next conversation.
Pleasure, Marcus. Thanks for having me.